Welcome, everyone. We're so excited to have you here as you join the webinar. I'm Alexandra Quinn. I'm the CEO of Health Leads, and I couldn't be more excited to be having this conversation with you all. As you jump in, please just drop your name. Who are you? Where are you calling in from? If you want to tell us what you do, that's fine too. If you want to share a fun fact, that's cool too. Um, and just drop your name in the chat. We're going to wait for a few more people to join. We're at about 200 people now, and excited to kick off. So before we start, I'll do a little bit of housekeeping while we're waiting for others to join. There are a bunch of ways to engage. We're really excited about having this be as interactive as possible. I'd love seeing the names in the chat. If you're just joining, please put your name in the chat where you're calling in from. I'm in Oakland, California, although I'm a New Yorker by birth and spent a lot of time in rural Texas. You can get your heads around that. It is an odd upbringing. Okay, so what do we want you to know today? Before we begin our conversation, we're going to record this webinar. And for those of you who are listening to this later, we're going to try to keep that in mind. And we'll also send links out for those of you listening to it later so you can actually click on some of the links in the chat. We're going to try to answer as many questions as possible. We've obviously peppered in the over 200 questions you asked in registration into the webinar. We probably won't get to everyone, but we are going to think about how we can answer some after too. Please submit all of your questions during the Zoom using the Zoom Q&A button. You can also use Zoom chat for whatever you want. You can ask questions. We'll ask you some questions. You can put in thoughts. You can put in whatever you want in there. Um, the webinar also has closed captioning available. So to enable that, please click on the closed captioning icon. And last but not least, we're going to be launching a few polls throughout the webinar and an evaluation survey at the end. And please be honest. I think, see this as probably a set of conversations. How can we answer what is AI in one webinar? It's not even possible, but we're going to try. And then hopefully we'll have some more conversations. All right. Welcome, everyone. If you're just joining, we have about 250 on board. Please put your name, where you're calling from, what you do, or some other, whatever else you want in the chat. And again, I'm Alexandra Quinn. Couldn't be more excited to be in this conversation. All right, so let's get started. I'll first just do a quick background. Who's hosting this? Health Leads. We work at the intersection of healthcare and community health and public health around how do you enable access to healthcare care, social needs. And our vision is health, well-being, and dignity for every person in every community. This conversation series comes out of some work we're doing with Mary Gray on something called Project Resolve, thanks to the AbbVie Foundation. And part of that, we actually wanted to have a conversation about what is AI and have it be accessible, and anybody can join at any level, whether you are a super user. I'm sure there are some of you in the audience that actually could be a panelist, and I'm sure there are some of you who don't even want to touch the stuff. And this space is for you, and this conversation is for you. So we're going to jump right in. I'd love to introduce our panelists. Please read their bios. Here's what I have to say about them. Each one of these speakers is a rock star in their own right. I'm not going to tell you a lot about them. You can read about that. What I asked them here today because of their values and passion on this topic. They have an unwavering belief in equity and the power of community, and they each come with a different perspective. One's a researcher and a practitioner. There's a doctor and an interviewer. There's an entrepreneur in every single one of them, and practitioners in every single one of them. And I think each one of you has been thinking about AI, has been using AI, has been asking others about AI. And so I'm really excited about what you could bring to the conversation. So let's jump in. And if you're just joining, I think we still have some people joining. Please drop in your name. Where are you? And we're going to tell you a little about who's in the audience. So we have all but one state represented. So 49 states represented, and it's a real mix of people in the audience and listening at the recording. And so what this told us, and if you can go to the next slide, is there's a lot of interest around AI and it goes across the spectrum. And that's what we geared this conversation for. We asked you a question, do you use AI in your work right now? So 33% of you don't, and we love it, and we want to know why. and 66.3% of you do use it. And it's across the spectrum. As I said, there were over 200 questions asked as part of registration. And while we won't get to them all today, we do hope to hit the highlights and get to them all later. So that's who all of you are. So we know who the panelists are, we know who you are. Please also let us know a little more in the chat. And let's jump in with the first question, which I'm going to hand over to Mary. So, Mary, what is AI really?
So this is one of my favorite questions. Thanks for putting this together, Alex, and welcome everybody. I would love to start with this way of thinking of AI that I hope brings it down to earth. So I want to ground the conversation in the realities of community-based organizations, so that you're thinking about how the AI tools that you're likely using today were designed either for individual consumers or for very large organizations that can usually customize their software. They can manage risk in different ways because they have entire information technology teams. They often have people like full time taking care of their technology. CBOs, for the most part, you all know this, you're facing a different reality. So you're often working with sensitive data, you have limited staff, often a lack of technical or legal support that would be needed to make AI both secure and effective for what you want to do. And that is the gap that is so important as context for everything we're going to talk about today, including what is AI. So, simple definition of AI at its core, next slide. Artificial intelligence is software. It's a very powerful software, and it's more or less a system of different software working together, but it's built to find patterns in data in order to make predictions about the future. It's really built to be a prediction machine. And AI has to look at what's happened before to identify patterns, and then it uses those patterns to guess what might happen next. Next slide. So AI's main ingredients, it's genuinely two other things other than code. It depends on a lot of data and a lot of computing power. The companies that build most of the widely used tools that are available to you right now have access to enormous amounts of both of these ingredients, including my company, Microsoft. Those companies also benefit from a feedback loop. Every time a person uses their products, more data is generated for future systems. This is called telemetry. This is an uneven access point, and it's one of the reasons that who gets to build AI right now and determine how it's working is so narrowly sitting on a few companies. Next slide. So you already see AI all around yourselves. It unlocks your doors. It can open your phone. It can organize your photos. It's running customer support chatbots every time you hit talk to a chatbot on a website, and it's recommending products and ads. So for today, I'm going to focus on two broad categories of AI that show up most often and have been around for decades. The first example, next slide, is predictive AI. Predictive AI finds patterns in data sets and uses them to make these predictions about what's supposed to happen next. And the kind of AI that has been around for a long time is essentially using statistics at a really large scale. And it's often referred to as machine learning. This was an approach to using computing power to be able to do this kind of predictive processing that was developed about 2 decades ago, not coincidentally when the internet and particularly social media started building up lots and lots of data sets to use as training data, what's called training data. Next slide. Predictive AI usually has a really narrow, clear, defined task. A classic example is spam filtering. It's my go-to example. The system is trained on emails that have already been labeled by you or at some other point by other people as spam or not spam. And from that labeled data, it learns the pattern to distinguish between spam and not spam. So the more you're flagging this is spam, the more the system is getting feedback from you about what should be put in your spam folder. That's done. Imagine everybody in the world who uses emails or flags a piece of social media, those are all places where that labeling activity is giving computer scientists and engineers more information about how to understand that data. Next slide. So once these systems are trained, they apply these patterns to new emails, and it hasn't necessarily had to see those emails. It's using what's called a classifier. So it's using how it's been shown labels of spam and not spam email and classifying them without having to look at any new email. It's looking for a pattern. Usually it's a pattern of words, it might be a pattern of images. The important thing to note, the system does not understand email. It can't read email in any literal way. It's matching patterns based on prior examples. Next slide. So the the second kind of AI I want to make sure you have a handle on is called generative AI. Most of the current excitement around AI is focused on this kind of AI, which is relatively new. Generative AI became widely visible to most of consumers in late 2022 through a tool called ChatGPT. It was one of the first products out there that let individual consumers, have exchanges with what's called a large language model. That's just a fancy word for a decision-making system software that was designed to predict the next word, the most likely word to come after a series of words. So instead of classifying or predicting categories or something really specific like the next spam that might hit your email box, generative AI is literally designed to create new images, new texts based on the questions that you ask it. It's pretty cool. It's pretty interesting, but it's not magic. It still is very much reliant on the data that it's been trained on. Next slide. So you've heard of generative AI usually through these examples of a chat bot. Next slide. Now, every company that sells you products, whether it's Microsoft selling you Office or Google Workspace or Facebook Meta, you're probably seeing more and more presence of generative AI tools. And so these different companies all have the same approach. These are basically large models, these systems of software trained to generate content by drawing on patterns learned from massive amounts of data. Next slide. So generative AI, it's trained very differently from predictive AI. Instead of carefully labeled data, the spam, not spam, these models are trained on enormous amounts of material from the internet. No kidding, like literally news sites, blogs, Wikipedia, forums, anything on Reddit, anything that could be bought or taken off the internet, it's part of these models. It's every book that's ever been scanned. So everything that is publicly, so-called, available on the internet is the amount of data that these companies have had to use to create the ability to respond to a prompt or to a set of words to create an image. The scale is so large in terms of the amount of data that has been required to train and create generative AI. No one actually has a complete record of exactly what is in the training data that is behind these generative models or how reliable or biased it might be. The assumption is the more data you have, it'll kind of all work out in the wash. Next slide. So I wanted to give you a sense of the scale. I know some of the questions that came up were about really the environmental impact of these models. It's real. Models like OpenAI's ChatGPT-4 were trained on the equivalent of tens of billions of pages of text. And during the training, the system learns statistical relationships between words. It's essentially calculating what word is likely to come next. So if I say Mary had a little, you might guess lamb. The training is basically looking at the number of times it sees that series of words and how often the word lamb comes up. And you wouldn't think it would need that much training to fill out that sentence, but think about all of the open-ended questions we now ask these large language models, and it's trying to compute what's the most likely response that's already been given in any of the training data. Next slide. So that's a lot of data. In terms of compute power, so when we're talking about computing, like how many computers literally did it take? Processing requires a lot of data. Training these models was the equivalent of hundreds of thousands to millions of computers running constantly for 4 months to train that first GPT model. That is every dot that you can see on that screen is 100 laptops. So it's more compute than any sort of software is ever needed to run its calculations to be able to do its processing and kick out what it was designed to offer, which is a prediction. This hopefully helps explain why so few organizations can build models and afford to update them at scale. So next slide. This is why data quality matters. And for me, one of the key things we can be doing is talking about the connection between data and the future of AI systems. For AI systems, the quality of predictions or generated content completely depends on the quality of the training data and how well that data overlaps with the problem that you're trying to solve. So next slide. So for specific use cases, having high quality, context relevant data matters more than simply having more data. If you take any situation of delivering social drivers of health services, you often need high quality data that is thinking about your location, the specific impact of, say, a storm or the presence of dictatorship, to be thinking, how do I need to respond next? And odds are really good once you've registered what you need to do next. You may or may not have typed it into some system, but to be able to update a model with that kind of data and have accuracy is incredibly hard. You have to control a lot, and likely the AI that is out there right now isn't the right tool and certainly not the most secure tool for what you would want to be able to do with that kind of data. So, last slide. The three key takeaways that hopefully you'll carry into our conversation next is that your data matters. In fact, it matters more than it ever has because odds are really good. You are good stewards of your community's data, and it's not something that was just sitting on the internet that trained all these large language models and text and image generators. Secondly, community-based organizations are going to need different kinds of policies that protect their data interests, and we don't have any of those policies right now. And third, until those policies exist, we need to build tools and make AI safer and more appropriate for real-world community use, because right now it's mostly built as a consumer toy, or it's built for very large companies that have an entire team behind them to secure their data and not have it taken up and folded into a new model. So with that, let me hand it back to Alex.
Thank you, Mary. And you had a lot of good engagement in the chat, questions around the definitions, thoughts. And I put a question in the chat before we go to Ray and Lisa, just like what's the feeling that comes up when you think about AI and as you heard Mary talk? It could be anything. Me, it's fear, curiosity. I'm in a deep rabbit hole. I'd like to say that's thanks to Mary for the past 2 years. And really appreciate that you both are trying to translate for folks sitting at Microsoft, right? Caring deeply about community governed data. So you deeply understand the fear, deeply understand the need of translation. And I think you'll appreciate some of what people are asking in the chat because it's part of, I feel like, your mission on this earth. So thank you, Mary. I'm going to go to Lisa next. And so Dr. Lisa Fitzpatrick has been doing, amongst many things, and running Grapevine Health, but also this unbelievable series on asking people what AI is. It's fun. We'll drop those in the chat. Lisa, what's AI to you, and what would you add?
AI is a helper. It is it's a tool I use almost every day for lots of different things, whether it's to record a conversation I've had and um, have it distill down the essence of what was talked about. And I'll say I'm impressed at how quickly the technology is improving because my primary concern on the clinical side was that people or the the language people communicate with me in, so whether it's vernacular, diction, colloquialisms in the community, that that communication was not going to be accurately translated, which would ultimately create more work for me to have to undo the errors. A year ago, that was true. And I'm shocked. I fed some conversations to an AI tool to translate, and it was nearly perfect. So I've been really impressed that it's been able to help in that way around translation. I also am really I think of AI as my biggest fan, and the challenge there is that every time I ask a question, it praises me. It it talks about how wonderful I am and what a great idea it is, but that's actually not what I need from AI. So I think we have to be careful in using these tools because they are designed to please us and tell us what we want to hear. And for a lot of the things I do, whether it's some sort of investigation or if I'm going to a site to really understand what I don't know or understand about a topic, I don't want the response to pander to me. And so I think that is something to be really cautious about and to remind people that we have to be very instructed, even though it's a great helper. Many times, it also can send us down the wrong path because it doesn't think. And I think we see the responses we get from these tools, and Gemini or Claude, and how elegant and sexy and personalized they seem to be. But it's still just numbers, and it's still, as you heard Mary talk about, what it is. It's software, but we are fooled into believing it's our companion, it's our friend. So I think helper is the best word I can use to describe how I think about it. But at the same time, we have to remember that we humans are in charge, and we are the ones who have to help provide the context and tell it what to do.
Thank you, Lisa. And so agree. When I was first training my models, my kids who are 9 and 12 are like, it sounds exactly like you. And to your point of how do you train it, I love Ashley Rogers, who's the former Health Leads team member, was gave a good prompt of be brutally honest with me. So, and Lisa, I want to hear later about some of the interviews you've done later, but I love this helper idea matched with Mary's data and software idea. Ray, we're going to turn to you next. And so Ray is the CEO of One Degree and is a practitioner in terms of taking the latest and greatest of AI and then trying to turn it into something that he can use for his organization. So a slightly different angle. So please, what is AI to you?
Thanks, Alex. Yeah, AI to me is a tool. And real quick about One Degree. One Degree is a nonprofit organization based in San Francisco. We build digital public infrastructure to help families access social services and benefits. And I'm going to start with this next slide, please. Quick article that my colleague showed me on the next slide. This is an old article from the Lancet. This is from 1862 when the steam engine was invented. This report warned, it had very, very real public health warnings about the incessant vibration of steam travel causing something called railway spine and something about uterine displacement. And back in the day when they viewed the human body as too fragile for mechanical speed, and the researchers at that time said that the jarring of the train was a literal assault on your nervous system, shaking organs out of your place. Very, very real health impacts that people were worried about. And the real issues that emerged weren't actually about people's organs falling out, as we know today, like we ride the train very often. They were about who got connected, who got left out, who got left behind, because railways connected wealthy cities first. So some towns died between railroads. And there are huge questions about the environmental impacts. I see a question in the Q&A about that. Environmental impacts of railroads, equity and infrastructure investment, monopolies, access. So I'm bringing this up because every major technology shift comes with fear, hype, and misunderstanding, and very rightly so. Like people are justified in being worried about the technology itself, and there are also bigger questions about who benefits, who gets left out, who controls the infrastructure, what kinds of systems are we building. Next slide, please. And in my work at 1°, I'm definitely not an AI hyper, but I'm also not anti-AI. We use AI in our work on a regular basis because we already see that it's changing how work gets done and how decisions get made in the world. And in our work at 1°, we started using AI because we have very specific problems that need to be solved. And we see the safety net is so broken, it's become a barrier to access. And we need more tools at our disposal to help that. As you can see here, 90 million people across the country live in economic insecurity. There's a massive time tax for low-income families across the country who have to access up to 10 different services and benefits per year just to make ends meet. And at our organization, we've been historically helping families access these resources using pretty much non-AI ways to do it. And what we've found is that over the last 14 years, the problem has shifted to finding and navigating the resource landscape to enrollment being a massive barrier. So things like intake forms, eligibility screenings, document verifications, referrals that don't go anywhere. Next slide, please. For example, in LA County, there are over 7,000 nonprofit services and at least 3,000 slightly different intake forms. Next slide, please. Across the country, we estimate that there are over 200 slightly different intake forms and eligibility applications that folks have to navigate and figure out how to deal with from their local perspective. So someone might get referred to a service, but then the referred organization spends hours calling people back, getting people to try to submit these applications, only to find out ultimately folks don't qualify for resources. And so they have to fill out another PDF, send documents over and over again, answer the same questions over and over again to the dozen organizations and services they need. In fact, only 1 in 3 referrals actually result in someone getting the services because of how difficult it is to receive the services. Next slide, please. So at 1°, we started this 1° AI Innovation Lab to solve some very, very specific problems that we've found very sticky over the years that just traditional deterministic tech was too slow or too cumbersome, too expensive to solve. And we started with 2 different prototypes. The first one here is our AI Resource Navigator. This lets people describe their situation in plain, natural language in their language, and then matches them to relevant services and programs using the conversational search instead of traditional keyword search and filters like you find on like Yelp, for example. This augmented generation. And we grounded this with 1°'s human verified resource database. So it's not pulling information from like random places across the internet. It's pulling it from a verified source. And we're super excited about like using this. And we've been tuning this with hundreds of prompts over the last 9 months to get this ready out there to be live. And we tested this with multiple frontier models, Claude, Gemini, ChatGPT, and we're excited to be rolling this out soon. The second one we have here, next slide, please, is our AI intake and enrollment tool. And this, the concept for this is that we want to take existing provider intake forms, digitize them automatically, pre-fill information from past intakes, and send referrals with already complete, ready-to-use intakes so providers don't have to chase paperwork and people can get services faster. The AI technology we use here is a document parser so that folks can upload their PDF intake forms or eligibility applications or take a picture of the applications that are already filled out. And that form parser automatically digitizes that information. And then the information gets extracted and created into a more standardized format. And then the converted data is taken to a structured format. And then that structured data is fuzzy matched by AI to be automatically and accurately filled out to other forms in the future so that folks don't have to keep filling out the same form over and over and over again. And our vision for this is to enable people to submit one intake form or enrollment form for all of the services and benefits that they need in a private and secure way. There's a whole bunch of issues that we have to deal with on that, which specifically around like the privacy and security of this, especially when you start to intersect PII or PHI with Gen AI models. And so we're experimenting with that right now. So those are the two main AI implementations that we have right now. We're super excited to roll these out and continue testing and learning. But part of the reason we built these two prototypes was because Gen AI was becoming like an existential threat to our organization, especially if your organization is about like information or data. Gen AI can do a lot of that already instantly. So we had to make sure that we have our answer to that technology in the future. So, all right, I just want to give you a taste of what we're doing. Happy to answer more questions. I'm passing it back to Alex.
Yeah, I guess, Ray, just stepping back from all of that, and one of the things I appreciate is this as a use case because of just how you've been thinking about it. Like, what was your feeling about AI and what enabled you to say, okay, I'm going to take a hold, understand, and implement?
My feeling on this is that if we don't move, we will become obsolete as an organization. And I guess that's a bit of fear. But as I mentioned, like if your organization or if your work has anything to do with providing information to somebody or something, whether by voice or phone call or email or data, unfortunately, that work is already obsolete. And so AI can do that work for you. And so we had to find an answer to that.
It's real. Thanks, Ray. I think that goes to our next question, and so many good questions in the chat. We're taking note of them. We're going to try to answer them. We wanted to talk a little bit about, and I'm going to turn to Lisa or Mary, whoever wants to go first. Like, why is this moment exploding around AI? And I think, the thing that I've seen on over and over in the world, but also in the chat, and what's the environmental impact of this explosion? And then we'll get to fears and all the other hard things. Lisa, why do you think this moment is exploding? Why is there so much money going into it? Explain
Yeah,
this.
I'll definitely let Mary take the environmental impact question. I know there's a lot of concern around that. And that's a really heavy issue that we have yet to grapple with. And I think most of us aren't even thinking about it as we ask mundane questions of these tools. Why is it exploding? I think it's exploding because in society, and especially in healthcare, organizations, people, leaders are a lot like lemmings. We don't want to miss out. So the fear of missing out on something, even though I think we don't truly understand the long-term impact of these tools and how they will exacerbate disparities, not only health disparities, but even the wealth gap in this country. I think people who really understand and are at the table in designing and having a say in whether or not there is or isn't regulation around this technology, these are the folks who already are at the top of the financial ladder. So what about the people who are being left behind by this technology? And I've been talking about the digital divide and how underserved communities are left out of digital innovation for many years. And I think this is just another one. So this is the new shiny toy. So, during the pandemic, it was remote patient monitoring, it was telemedicine visits, and everyone got on that bandwagon because there was money to be made. And that's the new shiny thing. And I think AI is very similar. And I think we have to be careful because while I've already told you, I think it's a helper. It's really increased efficiency or improved efficiency for many things in my day-to-day work and personal life. But when I zoom out and think about who's not benefiting that really could benefit from this. It really concerns me. And so you asked about the street interviews I've been doing. So I've been doing street interviews for 15 years, but lately I've started asking people if they even know what AI is. And you put a link in the chat to one of my LinkedIn posts, and that post was about an aha moment I had in the deep South. I asked a woman what she thought of AI, and she says, I think it's all fake. It's just fake, fake, fake. And most of the people we talked to that day had the same feeling that this is just deep fake videos on the internet. They didn't understand they're using it, it's in their hand. And when I asked her what she does with her phone, she says, well, I talk to Siri. I have Alexa in my house. She uses voice to chat on her phone. So she was not aware that she's using AI every day. So this is the question I have, like, whose responsibility is it to ensure that underserved communities really understand and are able to leverage this technology to improve their access, to improve access to information they need, to improve access to financial resources and wealth, frankly. So I have quite a few concerns. As much as I like many aspects of the tool, I think this is a conversation it's urgent. And we need to talk to more people like those folks we've been talking to in underserved communities, because their voices and their concerns need to be at the table as well, so that, you know, we don't know where this is going. But I do know if we keep going the way we're going with limited and few voices at the table, at the design table and at the policy tables around this, we will exacerbate these disparities in ways we can't even imagine.
Thank you, Lisa. Now we're getting in it.
Yeah,
This
because
is, go ahead. Go ahead, Mary.
I would say, Dr. Fitzpatrick, just like this is the key issue. And most of my earliest research was studying the digital divide. So I think the hardest thing for me is like we learned so much about what happened when the internet was rolled out and no one was thinking about what does it mean that you have to have a very stable electrical grid. You have to have some basic things that we still grapple with. So to the environmental cost question, I wanted to put a couple of facts in front of you. Definitely fact checks this. There's more and more research that's trying to get a handle on what is the all up environmental cost. But if you think about, I'm guessing if I asked everybody how many people use a search engine, either Google search or DuckDuckGo, you probably all raise your hands. So think about your daily use of Google search as another case of how much you're using compute power. This is where none of our hands are clean. And the early days of Google search had computing systems called servers and data centers that were incredibly hungry and not efficient. And over the decade or so that Google's existed and other engineering efforts have gone into reducing the environmental cost, really the heat. It's all about the heat of the computers running fast. So being able to get more efficiency out of those machines has brought down the environmental cost of a Google search. But when we first started using Google, it was incredibly environmentally wasteful. Very few people were tracking that. Actually, there was a great New York Times article that had some of the best first swings at that. Google searches still cost environmentally about a gram, between a gram to 3 grams of CO2. So emissions, so that's how much it's kicking out every time you search. That's why, please, if you know the web page you're going to, just go to it. Don't use a Google search to find your page. The cost of training a model, and this is an important distinction, the stats that I gave you about training a model, which involves lots of data being compiled and lots of computing power, all of that hot energy going on, it takes anywhere between 23 kilograms, not just gram, 23 kilograms and 25 tons of CO2 to do what ChatGPT is doing every day. And not just ChatGPT. Every time you're looking up a Google search now, you see that it gives you a summary that Gemini is hosting, is dishing up a summary. Anybody using any of these tools right now is caught up in the use of AI that no one other than the companies that produce this product have had a say in setting the terms. So I go back to Dr. Fitzpatrick's point. It's if we aren't collectively kind of voicing collectively our requirements to expectations, however we're going to land the policy around this, the demand that these tools not only be environmentally sound, but some little things could be done right now. I'm just going to give my favorite shout out to the question about high quality. Right now, the reason it's so expensive to keep training and updating these models is because no one's making a distinction between the kind of material you would get on a subreddit and material that you might be able to curate yourself from your own data generated in the course of your work serving others. So Ray mentioned a really great technique called ragging, retrieval augmented generation. Like that's a really great technique to reduce the cost of being able to use these models. But researchers have barely had any incentive to look at how to be even more efficient if you have exactly the kind of data you want to learn from. So imagine if you have the data you want to learn from and you know it's good data, it's not garbage. You can actually really produce a decent model with high quality, curated, well annotated data. And that's a technique that no computer company, no industry giant right now is incented to try. That they just are basically feeling like they don't have time, which is, not I'd swear right now. But that's the problem. There's not enough pressure to look for the new ways to do this more responsibly.
But
Thanks,
can I
Jen.
add to
Please, yeah.
something you just,
Lisa, go
oh,
ahead.
sorry. So you mentioned the word garbage. I think one of the challenges, particularly on the health side, is that these models are grabbing information from all over the place, and it can be inaccurate information, it can be conflicting information. So this is another reason it's so important to have a human in the loop. There's an active conversation about whether or not these tools are going to displace people like me, thinking, feeling individuals who take care of folks and who can understand a research study and help demystify it for a patient or a community member to say, these are the things you need to be thinking about in this research study. All the AI can do is just, as you mentioned, identify patterns and draw conclusions, but who knows if the data it's looking at is accurate or not. So I think this is the caution that I think about a lot, especially in healthcare, because people are getting really excited about the power of it. But garbage in, garbage out is the phrase we often used at CDC. And I'm an epidemiologist. We didn't talk about that, but this is a sore spot for me. We have to create some accountability about where the data are coming from.
That's right. And Mary, I can see you want to jump in. I'm sure Ray does. I just want to pause for 1 second because I think we're getting also into the question we really want to answer, and this is also in the chat around just the structural bias already embedded in AI, right? And to me, it's a great distraction of shiny tools, people jumping in, having questions, and then also it getting more and more biased in some ways. And that's another freight train. I want to ask, and we have an amazing chat that's on fire with a lot of expertise too, which I appreciate. Let's just ask a question of the audience right now, and please drop it in the chat. Like, what keeps you up at night about AI, right? What are the things that are open questions for you, keeps you up at night? We saw structural racism, bias, environment. Please just drop it in. And what we're going to do is I'd love to answer the question around how do we actually enable AI to be more accountable? How do we think about structural bias and equity? How do we think about this? And Mary, you're welcome to jump in first. Around what you wanted to before too.
A really basic thing I wanted to add that The hardest thing is when machine learning as a technique first started out and folks realized, like, gosh, there's a lot of a bias in this data. The move was, it's an understandable and kind move. It's like, we'll debias that data. That is really, really hard to accomplish, especially in any case where there isn't a right or wrong and something's debatable. So that I think if everybody could keep in mind, bias is really obvious if you experience it, if you know what it looks like. And once you know it, you know what to do with it. If it's something that is systemic, structural, almost by definition, machine learning is going to suck at getting it out of the system because it's just like peanut butter. It's spread throughout. It's just reinforces itself with the data that it has. So the example I like to give is language. It's really good at translation. It actually has no way technically to be able to learn a language that's spoken. That language has to be digitized and turned into text. So it's incredibly biased against any language that's not often spoken and written, and that it cannot support translation for code switching. Like if you're someone who uses multiple language, AI fails at those tasks. Why? Because it is a really clear place where technically it doesn't know how to decide what's right or wrong. And bias, in most cases, you know it when you see it, but it's very cultural and it's incredibly opaque. I mean, by design, that kind of structural, um, uh, you know, discrimination is not something you can take out of the data unless we stop producing it. Producing it and then creating data traces that are basically the reflection of the racism and structural violence that organizes all of our lives. So I think I'm much more hopeful about the human in the loop that Dr. Fitzpatrick mentioned. It's like if you have someone who knows what they're doing, they're so much better at spotting when the AI is off. And the main thing is don't let it make decisions that are not a low risk, obvious next direction because it will fail you. How could it do otherwise?
Thanks, Mary. Ray, do you want to jump
Yeah.
in on this too? How do we combat inequities and bias in AI?
So I want to double tap on that and also something in the chat about like reliability. There's some real concerns and questions about reliability, especially from Gen AI output, which is very, very fair. AI today is not reliable 100%, and we shouldn't pretend that it is. There are still hallucinations and errors and inconsistencies, and so that means we have to be really careful about how and where we use Gen AI, especially in our work here in the sector. But I also think it's important to remember that this moment right now is probably the worst this technology will ever be. The models are improving at such an incredible pace. It's like breakneck pace. And for example, if you've ever ridden like a Waymo, one of the self-driving taxis, a few years ago, they were jittery, they were kind of like scary at times, and then now they're super smooth. That's because of the learning that's happening in the background. And I'm not saying it's perfect. It's still, I don't think it's still 100%. But I think the question is, I don't think the question is like whether AI will become reliable. It's going to get there at some point. I believe that. The question is, what are the guardrails that we need to build now? What are the governance that we need to build now? What are the community ownership models that we need to build now? And how do we learn and understand the technology rather than kind of like shy away from it and pretend it doesn't exist, right? And that's part of what we need to do on our teams. Like we have to understand how to invest in our own data collection processes so that we are contributing data that is not biased and helps with ethical standards. And also we have to be careful about like what decisions in your organization you are automating with AI. Like it's very fine and dandy to like summarize notes, like if you're, at a doctor's appointment. But if you're using AI to make, for example, eligibility decisions or coming up with like risk scores, humans should definitely stay in the loop to make sure those high stakes decisions are accurate. So just wanted to share that.
Thank you, Ray. Yeah, and I
But
think
Al,
jump in, Lisa, please.
I just wanted to add on this point that we need accountability for ensuring the data are not biased. These data come from people, and I think we know historically we know that even when you train people, you expose them to subconscious bias. I mean, there are all sorts of tests about this. We've been talking about this, but it doesn't eliminate the bias because it's so deeply ingrained. And the people who are designing these models, are they aware of their own biases? And I've encountered this when I've talked to these tools. So I think the question is, well, where does this accountability come from? And how do we implement these types of guardrails to ensure it's not happening? Because these are humans that are creating this software and technology. So I don't know if it's going to be possible for us to eliminate the bias if we can't fundamentally address the foundational issue that the people at the table who are building these tools, they don't often invite people like me to the table to sit down and talk about, these hundreds of interviews we've had with people who say, I don't know what this is. I don't understand how to use it. I'm fearful of it. Or, yes, I'm interested, but where am I going to learn about this? So I don't want us to think this is all going to magically improve on its own. There has to be some intentional effort to identify the bias and to come up with a strategy to truly try to eliminate it. And I don't know what it's going to take, but we have to keep talking about this because it's not going to improve as the models improve.
I mean,
Great.
can I pick up that point? Because I think one of the hardest things to accept in the tech industry is there is no technical way to eliminate the bias that you're describing because it is something that gets reintroduced. So, and in fact, I want to kind of lift up something, Ray, that you said before, which until community groups and really the folks who are generating the data have not just a say, but control over what are you doing with the data I produced that was not data to me. It was a conversation with my mom, or a conversation with my doctor. Like until we have a real say in being able to say what happens next with that data, we don't have the basic right to be able to intervene and say, I actually want you to closely scrutinize what happens with AI in this sector. So the other thing I want to say is like everything we're bringing up about how you have to constantly keep up with what's changing, whether that's new iterations of hate or new iterations of crisis, that is where the model has to be updated because 2019, 2018 knew nothing about COVID-19, right? So we really have to take to heart as the world changes around us, which is only happening not more rapidly, but we're all kind of caught in the centrifugal force of right now. The model will stale. Talk to any teenager. It can't understand most teenagers, and the kids of those teenagers will not be just immediately understood because technically that's not something these software can just do on their own. We have to train them. We are their trainers.
Thank you, Mary. If you can believe we have 5 minutes left. And so I just want to highlight a few things. The chat is fire. And honestly, this feels like we don't need a set of series. We need a movement coming out of the chat in this conversation, right? Like that's what we're really talking about. Because I appreciate what Artrice put in there of how can you eliminate bias in AI and what you're saying, Mary, and what you're saying, Lisa, if we are so in a hole in terms of understanding structural racism and bias in our systems in the United States anyway. And so we have a real uphill battle in front of us, which is part of the reason I think it's important. There's so much expertise in the chat, there's expertise in this panel, but how do we actually level the playing field, as Lisa's talking about, in terms of who's designing, who's listening, who's owning data? And that's what you're all saying too. We definitely need a part two, and we need to take all of these questions and great ideas and put it together to understand what can we do as a collective. Because I'm personally interested in this as a movement. I'm interested in this and thinking about how can we not have AI just replicate all of our bias and racism, and actually what can we do to get in front of it, working with each one of you. I'm going to give you one. We need to do a poll around the webinar and what you want to see next. I want to ask each one of you a lightning round of what is your biggest, so here's the, please give us honest feedback on the webinar. Again, we knew we wouldn't get to everything today, but what is your most important thought or advice as we're wrapping this up around how we combat inequities and think about who's around the table? Ray, you go first, and then we'll do Ray, Mary, Lisa.
I think let me put my thoughts together around this. There's so many thoughts, especially in the chat, that I'm like, there's so many things I want to say right now. And I think it's healthy to disagree with folks. This is a very, very consequential time for us as a society. There are a lot of decisions being made by folks that are not in this room, by gigantic tech companies. And the feeling of powerlessness is very real, very, very real. And I think we want to hold on to like whatever power that we have. But I think one of the things that we need to do as a community is to try to harness our own power, especially the nonprofit sector, healthcare, social services sector. We need funders to come in and engage, not in kind of like the pocket change innovation kind of way, because a lot of times funders right now are sitting on the sidelines. But we need real funding so that we can combat the for-profit capitalistic narrative and structures that are happening right now. Otherwise, we're going to continue to have these kinds of conversations 10 years from now when the new version of Gen AI comes out. We're going to keep talking about like how things are so inequitable in our technology systems because we didn't build the guardrails, infrastructure, and community ownership and community governance and data ownership that we need now. So that's what I'll end with. Thanks.
Thank you, Ray.
Yeah, for
Mary,
me,
1 minute.
Yeah, for me, it's the internet and the digital divide wasn't brought to us by any one specific company. AI is definitely creating a divide, exacerbating one, and is brought to you by exactly 5 companies right now, by and large, and one of them is the one that I'm employed by. And I walk around constantly saying, you can't think about these tools as simply something fun for a consumer, a personal thrill, or for large companies. We have to demand that these are technologies that have a social impact that run through every piece of our daily lives, and that makes the responsibility of tech companies wholly different than it was before they launched these things. So I think it's all about different economic models for controlling them and demanding that this industry be as responsible and called them to the table in the way that biomedicine was called to the table in the 70s. Biomedicine doesn't get to just, just willy-nilly do experimentation. Tech companies shouldn't either.
Thanks, Mary. Take us home, Lisa.
Well, I'm really inspired by all the comments. I haven't read all the comments in the chat, just a few of them, but hope that we can socialize these and really address some of the main points here, which are, if there's no accountability, who is incentivized? I saw that comment. Who is incentivized to actually close these equity gaps and to mitigate the bias and the disparity we're going to continue to see from this? So, my take-home message for all of us, myself included, is to think about, am I willing to sacrifice something to actually make this happen, to make this more equitable? Does it mean I use these tools less? Does it mean I spend more time using my voice, using my pen? I write a lot to really push back and demand, that we have a seat at the table when they're designing these tools. And I think there's so much power in the people who are on this call, on this webinar. And I think if each one of us really thinks about what we specifically can do and what kind of sacrifices we might be willing to make, whether it's for the environment, whether it's for equity, what can we do to help? And I think this is just the beginning, and we've probably raised way more questions than we answered today. But I was really benefited by it, and I thank you for having me here.
My pleasure. I am so thankful to the three of you. Thank you to the Health Leads team and Brianna. So appreciated the chat. We're going to need to do this again. I can't believe we still had 250 people hanging out one past the hour. We will have a part two. We will share the chat. We'll do a lot of thinking. Appreciate the honesty. And I appreciate that this is going to help us propel forward to really think about this as a movement, not just a set of conversations. Thank you. Thanks for joining, everyone.